Okay, so we will move on to our next presentation by Director Elise Jones, Behavioral Health.
All right, thank you, Mr. Chair, Board. We have many accomplishments. We've been very busy. I'll start out this presentation by clarifying that county mental health plans and drug Medi-Cal plans are guided by the Department of Healthcare Services, who works with the federal government to identify standards for treatment and care, and we are primarily funded through Medicaid reimbursements. At this time, the announcement from the OMB, the federal government, does not appear to apply to behavioral health. All right, so we did go live with our mobile crisis response team benefit just a little over a year ago. I'll be looking forward to coming back here in the near future to actually present specifically on that. In fact, our team has been asked to lead a workshop and presentation at a conference in California to support other rural counties with implementing their mobile crisis benefits. So we are very pleased with that work. We, of course, also joined the Drug Medi-Cal Organized Delivery System on July 1st, and your board also recently approved the integrated contract that combines both specialty mental health services and drug Medi-Cal services in one agreement, which delights and thrills me. It's reduced administrative burden and aligning of treatment priorities, which makes sense. Okay, we have Medi-Cal site certified all school sites in Lake County. The Lake County Office of Education provides specialty mental health services in schools, and they're continuing to grow their program. Again, those services are fully reimbursable through the Department of Healthcare Services, and because they are for youth under the early and periodic screening, detection, and treatment benefit of Medi-Cal, those are eligible for 100% reimbursement in Medi-Cal. So those are great services to roll out. We are also continuing our implementation of the Early Psychosis Plus Intervention Program grant that was awarded in 2021 through the Mental Health Services Oversight and Accountability Commission, which has been renamed under SB 326, and I cannot remember what it is now named, but it is essentially doing the same thing. We actually will be bringing forward here an extension to that grant. We do have some unspent funds that they're allowing us to roll over and hopefully support some infrastructure, including the purchase of vehicles. So that's nice and exciting to continue that work. We have done a lot to be very present in the community, expanding our outreach and engagement efforts, in part through the award of our $1 million Mobile Crisis Program grant through the Department of Healthcare Services. And we will be at a later time bringing forward specific data about that. Medi-Cal also has a new peer support benefit, which means that individuals that complete a training and credentialing process may bill Medi-Cal for certain select services. Why is that neat? Because we know that when your treatment provider looks like you and has similar experiences to you, it makes a difference in treatment outcomes. People respond differently. And so we are definitely capitalizing on building our peer workforce, recognizing, of course, that many of our leadership staff are also peers in behavioral health. Workforce development, on that note, continues to be a focus for us. We have built out a career pathway recognized internally for our staff to navigate how you go from being in the front office to, the director. What does that look like? So it's important for us in planning for vacancies in leadership and things of that nature. And we have been building out our training plan and really focused on empowering staff with trainings to allow them to do the best services possible. We have released the RFP request for proposals for the county's opioid settlement funds. That RFP closes on January 31st. We have received several proposals, and we're excited to move into that work here in the future. As your board is aware, the County of Lake also has 2 behavioral health continuum infrastructure program grants that were submitted in December. One is for a 16-bed duly certified mental health rehabilitation center, as well It's a duly certified ASAM, which is an addiction, Society of Addiction Medicine certification for inpatient treatment, which is pretty unique and novel. And of course, also the application to renovate and expand our South Shore Clinic in Clear Lake. And I believe that expansion, if awarded, would provide an additional 13 or 14 office spaces. Thank you so much. Okay, we are moving into the final phases of CalAIM reform for behavioral health. Of course, as we discussed, the most recent CalAIM initiative that we moved forward with was the Integrated Specialty Mental Health and DMC ODS contract. Just a note here, it does align most of the treatment standards more closely to align with mental health standards. We are also an early adopter of this along with several other counties. And then confidentiality is something that actually gets ramped up, and we have different levels of confidentiality. So substance use disorder treatment services tends to be governed by the Code of Federal Regulations 42 for confidentiality, which is stricter than HIPAA. And so we're having stricter confidentiality in our plan, which is just something we're doing. We are also looking forward to completing more CalAIM benefits or enrolling in more CalAIM benefits. The managed care plan, which in Lake County is Partnership Health Plan, owns, if you want to call it that, CalAIM benefits that include transitional rent, enhanced care management, and community health workers. And so we are in the process of looking at executing an MOU, a Partnership Health Plan, to be an implementer of these specific CalAIM services. Of course, community nonprofits and other organizations can independently contract with Partnership Health Plan to provide these services as well. We continue to focus on building in-house capacity for medication-assisted treatment and narcotic treatment program services. We do have an operational MAT, medication-assisted treatment, out of our North Shore Clinic. We are looking at expanding that and continuing to grow those services within the county. It's really critical. We are also continuing to prepare to join a new waiver, which is called the BH Connect waiver. Significantly, it includes bundled rates for some services like full service partnership, assertive community treatment, and we are just moving forward in the process, continuing to analyze how that aligns with our department's strategic needs and goals, and continuing to ensure alignment with opting into the BH Connect waiver. It'll be a similar process as you've seen with the DMC ODS waiver. So there's all these waivers, and this is just another one, which is an expansion. Continue to stabilize Medi-Cal billing, just confirming our department's understanding that we have repaid back $2 million of the $4 million loan. Unfortunately, the Department of Healthcare Services they got caught up for a minute and then did not. And that is unfortunate. We have been in really close communication with CBHDA as well as my contacts at DHCS to resolve that. Primarily, a lot of our reimbursement issues revolve around our contract with New Life Clinic, which is a Tribal 638 clinic operating out of Mendocino County, providing methadone and other NTP services. We have many Lake County beneficiaries who attend that clinic, and the state struggles with the payment structure inside of their own system, and claims get stuck there. And so we actually still have claims dating back to 21-22 for New Life. Those claims for that year are about $250,000, and then moving on, we are still far behind in seeing reimbursements from DHCS, despite the fact that we're required to keep up our intergovernmental transfer account, which is where the federal financial participation goes and lives. So you just trade up local monies to the state, they trade it up to the feds, and then you get everything back, depending on that person's aid code. So it's very complex and nuanced, but we are working our way through that. All right. Okay, so this is just a count of services just to get a sense of the volume of care that we're providing people in the community. So for mental health in 23-24, we saw unduplicated, that is unique new individual clients. We had a roster of about 2,300. A little over a quarter of those were young folks, which I think is great. And I love to see that. And I would also note that it looks like it's a decrease, or we increased this year. So looking forward into mental health services for 24-25, you can see that we even increased the share of clients served in that young adult age range or children's age range, which is what I would expect to see with the expansion of mental health services in the schools. So that's, even though it's only 3%, I'll take it as as a good sign. For SED services, we are holding in 23-24, we had about 498 clients enrolled. To date now, we have about 399. And of course, circling back to mental health, you can see that there is a lesser client count, but of course, we're not all the way through the year yet. So we'll come over. We will exceed 23-24, it looks like, if this continues. So we're continuing to me, that says our outreach is going great. We're penetrating into our communities more and providing more services to more individuals. Thank you. I don't think so. Is that it? Perfect. Carolyn, could you move that little thingy that's, or do I have a thing? Oh my gosh, I do.
Stole it from
No, I didn't. It was right here. Somebody did. Naughty, naughty. Okay. Thank you. Okay, so these are just, again, some data points and metrics that we're looking at, kind of projecting into the future. And I do want to let the board know that we are working on, we have a pretty nice draft plan for a strategic plan. We're doing some internal work with that before we bring it out for public comment. The venue of public comment for that will likely be the Behavioral Health Advisory Board, and further information about that will be coming soon. But we are continuing to align with state requirements that were initiated in 2021 with the Behavioral Health Quality Improvement Program. You can also view all of the data. There's a hyperlink in there if you're able to access the presentation electronically. The state is big on unified data reporting and tracking for all counties, aggregate and disaggregated. So California Mental Health Services Authority is actually supporting a lot of that work and helping counties visualize and learn about their data and compare it to other counties. So we do have standardized outcome measures that have been set by the state and informed by the federal government for both plans, mental health and DMCODS. So we are required as a plan to track antidepressant medication management for both acute and chronic individuals, how well we're following up after somebody has been hospitalized for mental illness or placed on a 5150, hospitalized, how do we receive them back into our community, follow up to an emergency department for mental illness that doesn't result in hospitalization, which is actually what happens most of the time. Most people who go to the hospital do not become, or the ED rather, do not become hospitalized. They leave with a safety plan. Also tracking our use of first-line psychosocial care for children and adolescents on antipsychotics. What does that mean in real people talk? Don't medicate kids for stuff that's their family's problem. And also looking at adherence to antipsychotic medications for individuals with schizophrenia. People with schizophrenia function better and are healthier when they take their medications. However, there's a lot of barriers to doing that, and so the plan is responsible to track how we're supporting those individuals who are most at risk. So that's just some of the highlights, what we'll be moving forward with that's aligning with the state. I believe that is all I have in there, Ms. Carolyn. All right, and then thank you. I did excerpt. This is right from the state website, and I really enjoy this graphic. This is from 2023. This is looking at all of those quality performance standards that I just previously identified. There are 6 of them, and how counties, I think we have 56 mental health plans. We have 58 counties, but 2 of them share. I cannot remember. And you can see we're really dead in the middle of the pack, which for me is encouraging. We're not really far behind. We're have plenty of room to improve. And so we're going to just continue on doing the work. We feel we're on the right track, and just over time making improvements to our processes will result in improvements in these standard outcome measures. I think that is that. And that's all I have to present today. Thank you, Board.
All right, thank you. Supervisor Sabatier?
Yeah, actually, I have a couple more questions that came up. This graph changes drastically in the sense that they select random measures. So we might be middle of the pack one year, we might be top of the pack one year, depending on what measures they're selecting, or are the measures always the same?
No, the measures are always the same.
Okay, because they just said select measures.
They were actually established in 2021.
Okay, perfect. Thank you for sharing that with us. I hope that you're right in what your statement was when you first came up, that it doesn't affect behavioral health. I'm reading that all 50 states are now not able to access Medi-Cal reimbursement sites. So I hope that nothing has changed since you last heard, because I know it said specifically Social Security and Medicare, not Medicaid. So I'm hopeful that you are correct, because that would be a different thing for us to have to deal with if that was not the case. You said there was 2 BHCIP projects. Are we both the lead for both of those projects?
No, Supervisor. We are the lead applicant for the county application, and then Redwood Community Service, I believe actually Anchor Health Management, is the lead applicant for the other project. But every BCHIP application in the county must have the behavioral health director's sign of approval to move forward. So those were the only ones that made it.
Okay, I was just curious because you mentioned 2, and I wanted to figure that out, so thank you. The last part, New Life. I know San Diego was also, I believe, supposed to be a helpful colleague in this situation, dealing with those 834, I'm sorry, I don't have the right numbers. 638s, thank you. That hasn't helped us in being able to move forward. Is there any other county that's also coming on board that might help us move the needle on this issue? The issue of reimbursement, that
Yes,
is.
not that I'm aware of it. We are hoping that with another larger county that maybe has more political pull with the state, they would be more motivated to get those claims through because they'll have a higher volume as well. It's going to be much more financially impactful for them. And it is also true that we have become the experts in this arena, so we've been providing a significant amount of technical assistance to their team.
Okay, well, it's too bad that San Diego hasn't, maybe they've helped move it forward, but haven't resolved the issue at all. And if it's possible, I don't feel I should ask you right now on the top of your head, but I feel like that number, based on the contract that we have and the maximum not to exceed, could be a fairly large number of what we're waiting for reimbursements through that program. Wondering if at one point we might want to revise what we just did earlier with our state lobbyists, that if we're talking millions of dollars, that maybe that's something we need to add to the list of things to advocate for, looking at state reimbursement to get figured out sooner than later.
Thank you.
I will open it up to the public if there's anyone that would like to comment about this presentation. Anyone on Zoom? All right, I'll bring it back to the board, and then I will thank you, Director Jones, for your presentation.
Thank you, Mr. Chair.